Hey, I'm Dr. Joseph Yaker, and as a double board certified hair loss specialist with over 12 years of experience, no one believes me when I tell people to wash their hair more. Your skin gets dirty. Oil, debris, dead skin cells, sweat, and hair products are going to build on your hair every day. Just like you're going to wash your face and body after you go to the gym, you need to treat your scalp the same way you would treat your face and body. We're not saying that you have to wash your hair every day. It will depend on the hair type and the person. However, washing your hair once or twice a week is not going to cut it. You are just allowing a breeding ground of dirt, oil, and plaque to build up on your skin. So wash your hair more. One of the most common things that people overlook when they start to thin is how much loss they actually already have. The rule of thumb is once you start to see spaces in between your hair, you've already lost at least 51% of your hair. I know that's not fair because there are people out there that as soon as they see a problem, they want to fix it. But unfortunately, our eyes actually won't view that there's a problem until we've already lost 51% of your hair. So that's why being aggressive and going to see a doctor right away, at least to get answers, getting a full checkup of your lab work, medical history review, making sure there's no other associated risk factors that are going to potentially coincide with your genetic pattern hair loss.
At what point should someone consider seeing a specialist about their hair loss?
I think the sooner the better. As soon as you start to notice that you're having some thinning, shedding, loss, or even breakage, it's very important that you go see a doctor. What's very interesting about hair loss is it is a medical condition, but when there's no hair problem, it is thought of only as a cosmetic condition. So the first thing someone typically does is talk to their hairstylist, their friend, their family member, and they're not really taking it serious enough. Once we have an actual hair problem, it needs to be mitigated as quickly as possible because the longer you take, the more hair loss there will be. And once we don't have hair anymore, we're more slick and shiny. Medications or just in general, non-surgical treatments cannot stabilize or bring back any hair once it's fully gone.
What common daily habits can negatively impact hair growth?
One common daily habit that can negatively impact our hair health in general is nutrition. Guys, we truly are what we eat. The better fuel you put in the body, the better outcome your hair will be. Your hair is an extremely sensitive organ. Any disruptions in the quality of your foods or even your caloric content will absolutely disrupt your hair cycles. So if you're going to ask what is the best diet overall for hair health, it will always be the Mediterranean diet, which is rich in antioxidants and anti-inflammatories. 97% of our hair is made of protein. So if you guys are lacking your protein intake, I highly recommend getting a nutritionist or going online to figure out how much protein you need for you and ensuring that every time you eat, you have enough protein on your plate. If there's any disruption in the balance of the nutrients that your hair needs, your hair will suffer. Another medical condition that's not really talked about that can contribute to further hair loss is insulin resistance. In every one of my patients, I will always check their insulin levels, as well as what's called a hemoglobin A1C, which is basically checking what your sugar level is in your blood over the course of 2 to 3 months. The reason why we want to make sure we don't have insulin resistance is twofold. It can actually activate or accelerate your genetic hair loss because when we have insulin resistance, it actually increases our free testosterone level, which is responsible for making DHT. So more free T makes more DHT, which can again accelerate or even activate your genetic hair loss. On a second front, it can actually cause stress-induced shedding. Why? Because with insulin resistance, we get oxidative stress and inflammation. So if we have that in our body, or what we call systemic inflammation, inflammation can lead to further hair shedding.
Could my hair loss be related to a medical condition like thyroid or anemia?
So hair loss can absolutely be related to medical conditions. When I look at patients, I need to know every medical history that they have. A lot of people assume that just having a thyroid imbalance can lead to stress-induced shedding, but there's a lot of other causes as well. Hormonally, not just thyroid, we have estrogen and the testosterone connection. Estrogen, especially for women, is going to help your hair. Estrogen does about 300 positive benefits for a woman. So what commonly happens is when women go through their perimenopause or menopausal phase, the estrogen levels not only go down pretty low, but they go down very rapidly. With testosterone, it tends to not drop at the same intensity. So now the ratio of testosterone to estrogen is off, and it tends to make testosterone more concentrated. Once that happens, and we know that testosterone converts to the hair killing hormone DHT, a lot of women will not present with genetic hair loss until they've hit their fourth, fifth, or sixth decade. It can absolutely happen younger, but most women will not begin to see their genetic hair loss pattern happen until there's a ratio shift between their testosterone and estrogen. Another aggravator of either stress-induced hair loss or genetic hair loss is birth control. When we look at birth control, a lot of people get the word progesterone or progestin confused. Progesterone is something that we make. Progestin is synthetic. So when you read your birth control and you see estradiol, which is estrogen, and then you see progestin, I want patients to understand that is not progesterone. Progestin, unfortunately, will actually form more of the hormone that we don't want for hair loss, and that is DHT or dihydrotestosterone. So when I have patients that are suffering from hair loss, I always look at all their medical history, surgical history, lab work, as well as if they're on birth control. And there are better birth controls than others when people have the sensitivity to genetic hair loss. You can always go on my website. I will provide a list of ones that have too much progestin versus the better ones. And we also have a full discussion on which IUDs are going to be better for patients who have genetic hair loss.
What is Dr. Yaker's hair care routine for maintaining his hair?
As a hair loss specialist and someone who personally suffers from genetic pattern hair loss, my hair care routine is simple. I wash my scalp every day with shampoo using a low pH, somewhere between 4.0 and 5.0, and then I follow it with conditioning. Not everybody needs to condition their hair every day. Mine tends to get a little bit drier, so I do need the 6 or 7 day a week conditioning. If I tend to exercise later in the day or I'm pretty sweaty, I then go wash my hair again, because we have to remember that our scalp is no different than the face. If it gets dirty, oily, and sweaty, and you go to bed or you go back to your daily routine and allow hours and hours for that to sit on your scalp, you're only creating an unhygienic environment. I also take topical finasteride combined with minoxidil to help stabilize my hair loss, and my goal is to be old and gray without losing any more hair.